Hello, my dear friends. Namaste and welcome. I'm Kavita, your host in PMC English channel, and I'm so grateful today for this wonderful series which we started recently with Dr. Akhil. And I know you loved our previous episode on physiotherapy and pain management. So today we are here with knee pain. I know a lot of people, or at any age after 40 especially, you may have knee pain. So, how to manage that? Let's come up with beautiful questions and let's welcome our guest, Dr. Akhil. Hello, doctor.
Hello, how are you, ma'am?
I'm doing great. Thank you so much. How about you?
I'm doing good.
Thank you. Thank you for coming again.
Thank you.
So, Dr. Akhil, what is knee pain?
See, knee pain, we'll understand in a general way, very simple way. Okay, knee pain is always like you have to understand. Knee joint is formed with the two bones. We call it as femur and tibia. There is also another bone called fibula, which is a supporting to the tibia, not forming joint with the femur.
Mm-hmm.
So femur bone is like thigh bone.
Okay.
Tibia bone is the shin bone.
Okay.
Okay. So these both together will form a joint.
Okay.
So there will be a shape like concave convex shape,
Okay.
where the concave convex will be sitting on one another to make the friction free movement. So this is the bone part. Coming to the structures, bone related structures, joint structures, there are ligaments which will support the joint. We call it as medial, lateral, anterior, posterior.
Mm-hmm.
You understand what is medial is and lateral is, anterior and posterior. Medially we call it as medial ligament, medial collateral ligaments and lateral collateral ligaments. ACL is the most common injuries which we see in any kind of sports or in normal life, and there is also PCL ligament, anterior cruciate ligament, posterior cruciate ligament. These are the ligaments, these are the structures.
Right.
Like for example, this is a room, we have 4 pillars. So these 4 pillars, out of these 4 pillars, we have to understand these 4 pillars will be able to hold the roof. In the same way, the joint has to be stable. If the joint has to be stable, then we should have also 4 ligaments. If these 4 ligaments, if one ligament is not there, that means that is not stable. This is the ligament part. Coming to the soft structures.
Mm-hmm.
So every joint will have a cartilage.
Right.
Okay, this cartilage is a soft structure. Along with this cartilage, there is also meniscus.
Mm-hmm.
We usually sometimes in any reports, if they are saying meniscal tear, that means your meniscal got injured.
Right.
Okay, it usually happens when you fall on ground, something direct hit, or somebody hit on your leg, something like that. So this meniscal will be like surrounding that joint. Okay, in between the joint there is a cartilage, and edge part of the joint will have that meniscus.
Right.
Surrounded by the meniscus, and in between that there is also synovial fluid. This synovial fluid will help for the friction free movement. Every joint have a synovial fluid. Shoulder, hip, knee, all the joints have synovial fluid. This synovial fluid will supply the nutrients to the joint. Okay, this comes to the structure now. So this is what about knee. Coming to the knee pain.
Mm-hmm.
Okay, now I said everything to you.
Right.
Okay, you understand how the structure is.
Right.
So pain causes different ways. One is stress pain,
Mm-hmm.
or after
Injury.
age
Right.
we call it as osteoarthritis.
Right.
Okay, so third is rheumatoid arthritis, which is because of the infections.
Okay.
Not different infection. RA is a infection where it will eat the joint cartilage.
Okay.
It's like a small virus. It will replicate and it will start eating the joint.
So after certain age it will happen.
No, rheumatoid arthritis is a kind of disease.
So that virus will increase and
Increase in the body, and it will affect the multiple joints. Sometimes it may affect only one joint. It depends.
right.
Okay, and infective arthritis is different again because
Okay.
of some infections, and some because of some injuries,
Mm-hmm.
ligament injuries, tendon injuries, muscle injuries, bone fractures. So these all are there.
Okay.
So these many categories are there.
Okay. So
Injuries
what
of
is the
some sort.
general category, like without any reason after a certain age people
Only
will get?
osteoarthritis.
Right.
That is purely osteoarthritis. And without any injury, nothing happened to you. Over the age you are getting pain, anybody will start feeling pain at the age of 30 to 40, in between that.
Right.
Definitely they will start feeling their knee pain, because the cartilage will be getting ruptured, eradicated, because in our body everything is temporary.
Correct.
Do you think the skin is not going to get wrinkle for lifetime?
Definitely it will get, yeah.
Yeah, it's a simple example. If your skin is not having that, when your teeth is not having that, when you're looking your eyes, the vision is not having that, even for the joint, for the organs, for the body, everything should get aged.
Correct. Correct.
Okay, there is a symptom for this, right? For everything there
Very
should be a
true.
symptom. For same thing, osteoarthritis, the symptom starts with the knee pain, where it will show grade 1 degeneration
Mm-hmm.
when
Like,
we go to
what is
an
that?
X-ray. Like there are grades
Okay.
in degeneration.
Okay.
Degeneration means that that whatever the cartilage soft structure is there, that is getting ruptured,
Okay.
eradicated slowly,
Okay.
slowly over the age.
Okay.
Okay,
Okay.
it has seen mostly when the patient is obese,
Mm-hmm.
because of the heavy weight, where the joint can able to hold that much weight, it will be very difficult to it.
True.
Okay, with that weight, if they are doing all the activities, walking, jogging, whatever they are doing, what will happen? The joint will get all the time rubbing, too much rubbing, right?
Right. Yes. Yes.
If you are rubbing it too much with over pressure, what will happen? If it may be a soft structure, it may be a smooth and soft thing, but when you are putting pressure and you are doing it, what will happen? Definitely it going to be rupture, right?
Right.
So with obese patients, we can see this degeneration early age. Even in younger ages also we can see, from childhood he or she is obese. If they are doing walking and everything without reducing their weight, they are put on their weight. Definitely we can see at the age of 30 only you can see that osteoarthritis.
Oh my God. So, Dr. Akhil, coming to the next question, what age group people generally get this pain, and especially knee pain?
That's what 40, because
40
yeah,
only.
because
Okay.
at that age obviously you are almost did all the job. If you are doing sedentary lifestyle also, it will get eradicated, because the sedentary lifestyle will not have good function.
Okay.
When there is not having good function, that synovial fluid also get slowly
It will reduce.
reduced.
Right.
You should have that proper function, na? Then only new synovial fluid will be forming. If you are using over function, then again it is a problem.
Okay.
So we have to understand whether we are working too much or not working. So
So, can we maintain this fluid with a proper lifestyle at
proper
any age?
lifestyle as well as proper diet,
Proper diet. Right.
because synovial fluid consists of nutrients.
Right.
So you should have proper nutrients in your body. So see, I always tell everybody, physiotherapy is always related with your food. I tell them so many times, every patient. Few people will understand this, few people will not understand this.
So, just with your guidance, or just with
Mm,
one
mm,
physiotherapist guidance, we
mm.
can have a right lifestyle with right
Yes,
food, and we can
yes,
maintain our health.
I can assure you, with if you are following proper guidance of a knowledgeable physiotherapist, then you are going to rock these things. Seriously, you will prevent most of the complications of your body. Most of the complications. Why? Because, let me tell you, because of sedentary lifestyle, you are developing your neck pain, back pain.
Right? Yeah.
When a physiotherapist is suggesting you to live this sedentary lifestyle, maintain this like kind of lifestyle, if he is following it, that means he started avoiding his neck pain and back pain. It may come at the age of 30, but we are preventing it to 40 or 50. That means we are improving your life for 10 to 15 years or 20 years. That's a huge gap where you can do lot of things in this time frame,
Yes.
right? So everything is delaying by a physiotherapy. It's not like we are completely eradicating or completely preventing, we will never get in your life. No, no, no. Definitely you are going to get engaged, you are going to get the problems, we are delaying it. We are stopping it to make your healthy life, to make you better, to live life to good extent.
That's true. So, is knee surgery important for everyone?
If the ligament injuries are happened, okay, as I said, 4 pillars. If the ligament injury happened, mostly we will see the ACL ligament injuries. ACL ligament injuries is something which will stabilize your joint. Means if you are walking, your knee joint will skip like this if ACL is not there.
Okay.
If PCL is not there, it will go like this.
Okay.
At this time, you have to understand in your daily life activities how much you are using your knee. There are few people who are living without ACL
Mm-hmm.
because they don't have that kind of activities much.
Correct.
If you are a sports player, if you are into sports, I will tell you every ligament is important to him, because definitely if it is not going to repair, it going to affect further more and it will damage completely. We have to understand what kind of injury it is, then only we can understand whether we go for the surgery or not. Coming to the injuries,
Okay.
coming to the osteoarthritis, knee surgery, like total knee replacement, we called it as total knee replacement. Whatever the cartilage, whatever the damage happened to the bone, they will remove it completely.
So, at what stage it
Like I said you, the degeneration stages: grade 1, grade 2, grade 3, grade 4.
Okay.
Grade 4, you have to take a call for the replacement. Grade 1, grade 2, grade 3, you have to wait. And I suggest you have to wait for the surgery at the most, like 50, above 50, 55, only you should take a call about the surgery.
Okay. So before that, we don't need to go for
Before that,
surgery.
if you are going, that means that is a very degenerative, like completely what we call
Last
in
stage.
the last stage, and you cannot able to bear the pain,
Okay. Okay.
something like that. If you are not able to bear the pain, if you are not able to perform your daily life activities, then that is the way you will have to take a call. But what I prefer, you have to make it more and more, push your limits. So everybody, I used to tell, and every time when you are knowing that you are having grade 1 degeneration or grade 2 degeneration, immediately you call a physiotherapist. Have proper guidance from him. What kind of exercises you have to do, what kind of activities you have to do, how you have to, what are the things you have to avoid to do. Avoid Indian sitting, avoid ground sitting, avoid direct forward bendings,
Okay.
because all these will improve the degeneration more and more, because it will give lot of pressure on that joint. If you want to stand, first joint will take the pressure after the ankle is your knee.
Correct.
You are putting your ankle, immediately your knee has to get activated if you want to stand, otherwise you can't able to stand. So you have to understand this biomechanics. See, physiotherapist is not only dealing with the anatomy. Physiotherapy will deal with the anatomy, physiology, biochemistry, biomechanics.
Okay.
If these four, if he or she is good at these four, they will do very good job. They have to know the anatomy, they have to know the physiology, they have to know the biochemistry, they have to understand the biomechanics. If these things they are very perfect, they are the best physiotherapist.
Great. So, I mean, one can understand in the starting stage only if we are getting a small knee pain. Also, if we consult physiotherapy, a good physiotherapy,
Yes.
so we may, deal nicely in for future.
Yes. For example, so many people won't go to the doctors or a physiotherapist.
Correct.
What happens once they got the pain or they get affected with the pain, they will have a painkiller. Obviously, as I said you, when you have a painkiller, it will suppress your symptoms. So your body is having a very good healing mechanism where it will heal by itself. What will happen when you have the suppressing the symptoms? It will start healing. Blood circulation improves. It will healing. Everything was normal. What you did, you avoided your pain. You didn't recover your pain.
Correct.
You avoided the pain. Once you avoided, twice you avoided, thrice if you are avoiding, that means you are degrading more. So I suggest everybody, when you are having a pain, initially you don't use a pain medication. You start doing some activity on it, or keep a cryotherapy or a hot water fermentation.
Okay.
Okay, use cryotherapy or hot water fermentation for 1-2 days, 24-48 hours.
Okay.
If it is reducing after that, that means you no need to consult a doctor.
Okay.
That's a normal pain, stress pain.
Mm-hmm.
Okay, then you have to continue with your, after that pain reduce, you can do minimal exercises. We called it as isometric exercises, static exercises, dynamic exercises. So we divide whichever is required. You can take online consultation for a physiotherapist. He will guide you, or he will show you, or she will show you. Then you can perform it, and you can continue it for a 6 months, 1 year, whatever the time frame you are comfortable.
Right. We may understand by passing of time that now I'm okay and
Yes,
now
I
I
can.
don't need more.
Yeah, I don't need more, something like that. But everybody has to do physical activity or physical exercises for themselves half an hour to 45 minutes in a day. That is mandatory.
And that there is no other option.
Yes.
There is no
yes.
other
No.
option.
Because if you want to avoid complications, if you want to avoid injuries, and if you want to stay healthy, your body needs blood circulation.
Correct.
Your body need mobilization. If you are not mobilizing your joints properly, you are just waking up, doing bath, going job, and coming back again. You are sleeping. It won't help you. At some point, your joints will get affected with some injury or some pain. It won't heal nicely because you are not doing any activity. You are not training your muscles. You are losing your coordination with your body. To be honest, because I want to tell you very clearly, even you become obese, if you are having a not good life, not a healthy lifestyle, you become obese. Will you able to control your running? Your brain can control it? No,
How it's possible?
because you are losing it from your brain. If you had done it before only, by doing some activities, coordinating with your brain, like I can do this activity, I can do this, I can just perform this activity. If you are not able to perform that activity, then there is a physiotherapist to help you. That we have to understand that point.
Correct.
A physiotherapist is not only a surgery part. Physiotherapy is about lifestyle, wellness, your posture, how you are sitting, how you are standing. We can guide the best posture. We called it as physiotherapy ergonomists.
Mm-hmm.
See, only ergonomists is different. Only ergonomists will concentrate on your anatomy.
Okay.
But compare with a physiotherapist and a combination of ergonomist. He know anatomy, he know physiology, he know biochemistry, they know what is biomechanics, and they know what is ergonomics. It's a deadly combination again. They will do very nice to you. So knowledge matters here.
So that's great. And how do you treat patient in physiotherapy, especially in pain or knee pain?
We already discussed that we deal electrotherapy,
Okay. Right.
and we said we deal with the mobilizations or manual therapy,
Mm-hmm.
and we deal with the strengthening exercises. Okay, coming to the electrotherapy, for any kind of pain management we use only two modalities, mostly widely used modalities. One is ultrasound, and the other one is IFT. There are SWD, there are shockwave therapy, there are laser. These all are different, but mostly used machineries are ultrasound and IFT. So these two are used to reduce the pain.
Okay. And is there any certain protocols for knee pain?
Yeah, that is what we are discussing now.
Okay.
One is electrotherapy to
Okay.
reduce the pain.
Okay.
Okay. Then coming to the after electrotherapy, we have to mobilize the joint. Okay. If there is a surgery, surgical protocol is completely different. If it is a conservative management is completely different. Okay. If there is a complicated surgeries, multiple injuries, then that is a different protocol.
Okay.
Okay. So these protocols, which are standardized protocols, what we will do according to our experience, according to our the patient psychological thing, we will modify little things. We will not completely change the protocol. We will modify protocol according to the patient comforts. But ultimately we are using this only. What I'm saying, I'm saying the IFT ultrasound machineries. Other than this, if you are visiting consultant like the center, then we will do the laser, then we will do SWD, or we will be doing waxing, something. There are a lot of modalities. Okay, this is machinery part. Then we will mobilize the joint to improve the range of motion. Okay, we will use some techniques also. There are different techniques, maybe Mulligan, maybe Maitland's, or maybe McKenzie, different techniques. So we will use according to the patient condition and patient comfort.
Okay.
After that, then we start strengthening program. So everything will be step by step. Okay, usually we will also encourage them with the passive movements. We call it passive movements. After the passive movements, which we will be done by the therapist, we will be doing passively. They cannot able to perform.
Okay.
Then we will encourage passive assisted.
What is that?
We will do passively assistance,
Okay.
but we will not completely give passively. We will only do. We will give passive assistance.
Okay.
Which
so they
means
have to do it.
they have to
you
do.
will guide it
We will
properly.
give passively. Okay, push. We will give some support and we will tell them to do.
Okay.
Okay. Then we will do active assisted. They will do active. We will just assist. We will not passive assist. There is a line again.
Right.
Okay. Then we will encourage them to do actively.
So it's a slow process.
Yes.
I mean, with the help of your passive assistance.
Passive, first is passive. Completely we will be doing because
They are not able to do
no,
it.
they will not. If we tell them also, they will tell very straightforward, sir, I cannot able to do, or I cannot able to perform. They will tell them very straightforward because they are in pain. When they are in pain, they cannot listen to us.
True. Yeah.
And if we are saying them to do, then that will be blunder mistake. They will shout at us also sometimes. Few patients will be there. They will shout at us. How can I do, sir, when I am in pain? You do it, sir. Understanding,
Correct.
right?
Yeah.
Something like that. Different patients have different psychological thinking. So we have to make them psychologically comfort. Then only they will listen to us. If they are not feeling psychologically comfort with us, they will not accept our treatments. And even they won't make comfortable to us to do. So this way we
that
have
is
to go.
that is understood, because if they are in a high pain, they can't even do that. So that is understood. And at last, this knee pain, is it like with injury or without injury? How it happens?
That's what. With injury, it is a different.
Right.
With injury, what happens? I said you, there are ligament injury. We have to follow a ligament injury protocols.
Correct.
Okay. There is a tendon injury. We have to understand the tendon injury and we have to go according to the tendon protocols, because ligament healing part is different, tendon healing part is different, fracture healing part is different. So we have to understand what is the healing time, what is the immobilization period by a surgeon. Then we have to plan for the injury things. Coming to non-injury, it's a very simple thing. Non-injury is always deals with the what kind of activity is aggravating the pain. Because without injury means with some activity only it will aggravate. Normally it won't aggravate. If it is aggravating normally, then we have to understand it may be a rheumatoid arthritis or a osteoarthritis or infective arthritis.
And it may cause due to unhealthy lifestyle.
Yes. Osteoarthritis mostly deals with the improper lifestyle or sedentary lifestyle. Sedentary lifestyle always damages health, but it kills like a slow poison. It never show immediate effect. It will slowly degrade your health. And one fine day, if you are look at back, you cannot bring it back, because whatever the time frame was happened, it has happened, and you cannot bring it back so easily. It will take again the same time or double the time
to recover.
to recover. That's why whenever the people comes to me, I will ask them the past history, because the history will say everything, whether it will heal, whether it will not heal, or whether it will take lot of time, or whether it will be done in the time frame. Because the history teaches us, okay, this was happened at that, and by this time it damaged this much, and from that time to now, how much it is get damaged, whether it is a reversible or irreversible. that I have to explain him clearly. As a physiotherapist, that's my responsibility. If I'm not explaining and I started treating him, he will be in a thought process where I will get recover because he's doing treatment. First of all, every time we have to make sure to understand them, what is your time frame of minimum period or a maximum period, and what we can expect in this time frame of treatment. Without knowing that, if you are doing a therapy, there is no point of doing it.
So it's equally your responsibility to make them understand and
Yes.
to accept that and to put equal effort
Yes.
so that they can,
Yes.
help themselves better.
Yes, because I will educate him when he, because see, in a day there is 24 hours. He will come to me for 1 hour or 45 minutes. Okay. I will make him to do at any cost because that's my duty. Remaining 23 hours, what he is doing now? It depends on him how many times he is doing, for how much time he is doing, and what way he is doing. He's doing proper or he's doing just time pass and he's saying that I'm doing it. Few people will say that, sir, I did the exercises. What you did, man? Then if I ask him to perform in front of me, he will do it wrong. Then only we'll understand easily that he's doing wrong. That means he's not doing it.
Correct.
If if he knows everything but he's not doing, simply he want to blame me. Example I'm saying, nothing I'm gonna lose. He's losing himself.
Right, yeah.
That's a simple thing. Every time I make sure to understand any patient, your life, your way of thinking will be always give you good health. My part or my duty, my role is always to give you the best. I'm ready to give my best, but you have to receive it.
Yes. And max to max, you will assist, you can help, you can extend your hand to help,
Yes.
but ultimately the patient or the person has to work
Yes.
on themselves.
Yes,
So
true.
thank you so much, Dr. Akhil,
Sure. Thank you.
for coming, for sharing all your wisdom, and people will get definitely benefited by this episode.
Yes.
So at last, your message to people who have knee pain.
See, knee pain, usually I'm saying at now present scenarios, which I am seeing, previously knee pains would have come after 50, age of 50, 60s, something like that. Now I'm seeing at 30s. Why? Because that's what I'm saying. They are not exercising, they are not meditating, they are not keeping stress-free life. See, why I'm always saying meditation? It's a simple point. If you meditate, your brain will become stress-free. Stress leads to a lot of complications. It will improve your mood. If it will elevate your body feelings. It will make you feel very good and comfortable. Your thought process will change. If you are not doing it, uh, definitely with that stress, you will feel affecting all your emotional imbalance.
Right. And any problem start or any health issue start from brain itself.
Yes, yes. Because of that stress, your nerves will get affected,
Correct.
and your thyroid system will get affected. Your hormonal imbalance starts. Everything is there. Because of stress, there are a lot of things. Because of stress, you may get affect sugar. Because of stress you may get thyroid. Because of stress you may get blood pressure.
Right.
See how
Yes.
many things it is. That's why I'm saying, with meditation, with physical activities, with proper diet, life is beautiful. So you have to maintain this. You have to plan that. As you are planning, most of the people will plan their careers. After 10 years I should be like this, after 5 years I should buy a car, after 5 years I should buy a house. You are planning your career. The same way you have to plan your body, that okay, I am at this age, I can able to perform these activities without any pain, without any problems or diseases. That means coming to the next 5 years or 10 years, you have to plan that. Okay, I should do 45 minutes of activity, half an hour of. If you are not having time, if you are excusing with the time, that means that blaming yourself. People will say, even me, including me, everyone will say, time nahi hai sir, I don't have time sir, I cannot able to perform it, I'm very much interested but I'm not able to perform. See, these all are excuses.
Very true. Yeah.
when you have time to watch a TV, when you have time to spend with your family, when you have time to work, when you have time to eat, when you will have time to do the activities. You're not skipping your meal, you're not skipping the TV. Nowadays, I can say you very straightforward, they are watching so many times Facebook reels, Instagram reels, every
Yeah.
time. In a 24 hours, they are wasting 4 to 5 hours on that only. We have so many things to do. We are wasting our time, simple, with reasons. So that is the thing.
That's very beautiful and very important and very straightforward answer. Straightforward message to everyone, friends.
Yes.
So I hope you learned a lot of things from here and you learned how to manage your knee pain. So please like, share, subscribe PMC English and share this video with everyone to your near and dear one. It will help a lot of people. Thank you. Thank you for watching this episode. Thank you, Dr. Akhil.
Thank you so much. Thank you,
Thank you.
PMC channel.